Welcome to our program. My name is Joanna Key Sampson, and I serve as the Program Director for the Integrated Interventional Radiology Residency, as well as one of the faculty members here at Wake Forest. This is the first in a 4-part video series designed to give you an overview of training in our Integrated IR Residency. In this video, we'll walk through the structure and curriculum of the program. Let me start by saying welcome. We're truly excited to meet you and to share more about our program and what makes training here unique. Our residency is based at Atrium Health Wake Forest Baptist Hospital in partnership with the Wake Forest School of Medicine. Over the years, our institution has experienced tremendous growth, allowing our department to remain at the forefront of innovation and patient care. We serve a broad geographic region, acting as the tertiary referral center for all of Western North Carolina, as well as parts of Southern Virginia and Eastern Tennessee. We're proud to be a Level 1 trauma center, home to a nationally recognized comprehensive cancer center, and a dedicated children's hospital. Our Integrated Interventional Radiology Residency received accreditation in April 2018. Since the 2024 match, we have been offering 2 integrated IR residency positions per year. In just a moment, I'll introduce you to our residents. We also have 10 diagnostic radiology residents per year, creating a dynamic mid-sized program with a nationally recognized reputation for excellence. Our institution is located in Winston-Salem, North Carolina, and attracts residents from across the country who are drawn to both our clinical breadth and our supportive collegial environment. Now, I'd like to introduce you to our interventional radiology faculty. Dr. Miller serves as our section chief. He completed both his residency and fellowship training at Duke University. Dr. Reagan trained at the University of Pittsburgh and Alexandria Hospital, and currently directs the Wake Forest Vein Clinic. Dr. Swinson completed his residency at Wake Forest and fellowship training at University of Florida, Gainesville. Dr. Berry completed his residency and fellowship training at Wake Forest. Dr. Emmons completed her residency training at Vanderbilt University and her independent IR residency at Stanford University. Dr. Corey completed his residency and fellowship training at Wake Forest. I completed my residency at Morristown Medical Center and fellowship training at Brown University. I'd also like to take a moment to introduce our program leadership. Together, we work closely to ensure an integrated and supportive training environment. Dr. Emmons is the Associate Program Director of the IR Residency. Dr. Geer is the Program Director for Diagnostic Radiology, but also serves as the Associate Program Director for Interventional Radiology. Let's meet our current integrated IR residents. Rafi and Shane are our current interns, completing their surgical internship here at Wake Forest. Shane graduated from Medical College of Georgia, and Rafi graduated from Florida International University College of Medicine. Mac and Haroon are in a first class of 2 residents, and they are currently R1s. Mac graduated from Edward Via College of Osteopathic Medicine, and Haroon graduated from Medical College of Georgia. Jessica is our second-year resident. She graduated medical school from Touro University in California. Jennifer is our third-year resident, and she graduated from the Medical College of Wisconsin. Achintia is our fourth-year resident. He graduated medical school from the University of South Florida, Morsani College of Medicine. And finally, we have Ben, who is our current chief resident, in his last year with us. He graduated medical school from Medical College of Georgia. This email includes a link to a video overview from our Diagnostic Radiology Program Director, Dr. Geer, who provides an excellent summary of the Diagnostic Radiology Residency. I encourage you to watch that presentation. In this video, I'll focus on key highlights in the Interventional Radiology curriculum. Wake Forest Baptist Medical Center is an 885-bed academic hospital serving a broad regional population. As a Level 1 trauma center and NCI-designated comprehensive cancer center, we provide care that meets the highest national standards. We're also home to a dedicated children's hospital. Our integrated IR residents gain additional experience at the Kernersville VA, focused on peripheral arterial work, and at the Wake Forest Vein Center, directed by Dr. John Regan. We believe you'll find the breadth and volume of cases in the Wake Forest Interventional Radiology Department ideal for developing skilled and confident interventionalists. Our program offers comprehensive exposure across all major domains of IR. In interventional oncology, residents perform a high volume of catheter-directed therapies such as chemoembolization and radioembolization, as well as percutaneous ablations of the liver, lung, kidney, bone, and soft tissue. The service performs more than 40 TIPS procedures annually and maintains strong portovenous procedural experience and percutaneous biliary procedures. Our venous and arterial practice includes complex deep venous interventions and management of varicose veins. Residents also gain extensive peripheral arterial disease experience through dedicated outpatient rotations. Our practice also includes the highest volume of vascular malformation interventions in the state of North Carolina. In musculoskeletal and pain interventions, residents perform vertebral augmentation, spinal tumor ablation, and neurolysis procedures such as celiac and hypogastric plexus blocks. Additional training includes uterine artery embolization, prostate embolizations, trauma-related interventions, lymphatic procedures, and a full spectrum of routine image-guided procedures including GI and GU interventions, dialysis access management, and CT-guided biopsies and drain. From high acuity trauma to complex oncologic, vascular, and pain interventions, our residents experience the full scope of modern interventional radiology practice. Completing your internship at Wake Forest helps you establish strong connections with the clinical partners who play an essential role in our patients' care. Because our program is categorical, our residents begin engaging with interventional radiology from the very start of their training. During the intern year, they spend a total of 8 weeks on the IR service, gaining early exposure to our clinical workflow and team dynamics. This early experience helps build a strong foundation for the years that follow. We also incorporate our residents into the IR clinic early in their training, beginning in the PGY2 or R1 year. During this time, residents complete a total of 8 weeks on the interventional radiology service. These early rotations give them valuable hands-on experience with patient care and procedural experience, while deepening their understanding of longitudinal clinical management in IR. During the PGY3 year, our residents spend a total of 12 weeks with the interventional radiology section, while continuing to provide longitudinal patient care in our clinic. In the PGY4 year, the focus shifts towards preparing for the core exam, complemented by additional IR and IR-related rotations. During the PGY5 year, residents complete 7 months of interventional radiology and IR-related rotations. This includes dedicated experience in the vein clinic and our outpatient-based lab, along with continued participation in the IR clinic. Residents also rotate through the intensive care unit and medical oncology hepatology services. They complete their diagnostic radiology requirements in mammography and nuclear medicine in this year. In the PGY6 year, residents spend 10 months in IR and IR-related rotations, further advancing their procedural independence and clinical judgment. They continue to see patients longitudinally in clinic and gain additional comprehensive peripheral vascular care experience through dedicated time on the vascular surgery service. One of the great strengths of the Wake Forest diagnostic radiology training is its strong commitment to independent call. As Dr. Gear describes in the diagnostic radiology curriculum video, our programs features a tiered call structure that begins unusually early, starting with Tier 1 call in January of the R1 year. This early experience sets Wake Forest apart, as many programs do not begin resident call until the R2 year of training. During Tier 1 call, residents interpret ED radiographs, including chest, musculoskeletal, abdominal, pediatric, and neuro-CT studies, while working alongside an upper-level supervising resident. This rotation follows a 7-night schedule from 11 p.m. to 7 a.m. and residents complete a total of 5 weeks of Tier 1 call between January of the first year and January of the second year. Tier 2 call expands coverage to include ultrasound, CT of the chest and abdomen, nuclear medicine, neuro-MRI, and cross-sectional musculoskeletal imaging. This call is also structured as a 7-night rotation from 11 p.m. to 7 a.m., with the Tier 2 resident providing supervision and support to the Tier 1 resident on duty. Tier 3 interventional radiology call serves as the primary call for the IR service and includes residents from the R1 through R5 levels. From July through December, IR residents at all levels share call approximately every 8th night. Residents from R1 through R4 receive a post-call day off, and during the onboarding period for new R1s, senior residents at the R4 and R5 levels provide backup support. From January through June, IR and DR residents at the R3 and R4 levels share call responsibility approximately every 12th night. All diagnostic radiology residents participate in this rotation, and post-call days are provided. A typical day on the Interventional Radiology Service at Wake Forest begins with inpatient rounding and preparation for our morning huddle by the residents. Most days, 2 procedures start at 7:30 a.m., except on Wednesdays when the morning begins with a dedicated didactic conference for IR residents at 7 a.m. The daily team huddle begins at 8 a.m., where we review the day's cases and discuss inpatients on the rounding list. Following that discussion, the team moves directly into the procedural schedule for the day. Integrated IR residents have protected time each week to attend IR-specific conferences. These sessions are held on Wednesday mornings at 7 a.m. and include a monthly quality and safety conference, a quarterly IR journal club, and regular resident case conferences and faculty-led didactic lectures. The Interventional Radiology Service also participates in several multidisciplinary conferences, including the Urology Tumor Board, Hepatobiliary and Thoracic Oncology conferences, where our residents are active contributors and presenters. Our Interventional Radiology Department includes 8 procedure suites equipped with advanced imaging technology. 2 are state-of-the-art GE units, and Wake Forest actually serves as a GE show site. The department also features 2 Siemens biplane systems, a Philips suite, and a dedicated Siemens procedure CT scanner. In addition, 2 rooms equipped with C-arms are designated for less complex procedures such as drain exchanges, PICC line placements, port placements, paracentesis, and thoracentesis. So why choose Wake Forest for your integrated interventional radiology training? Our program offers several key strengths that set it apart. First, the intentionally small program size allows us to tailor your training experience to your individual interests and career goals. This close mentorship model ensures strong faculty engagement, abundant hands-on opportunities, and personalized guidance throughout your residency. Our high case volumes provides progressive autonomy, so you'll graduate fully confident performing procedures independently. The breadth of clinical experience spanning the main medical center, the Vein Center, and the Kernersville VA offers comprehensive exposure to every major area of interventional radiology, including peripheral artery disease, venous work, and longitudinal clinic care. Equally important, you'll gain extensive experience in patient selection, pre- and post-procedure management, and clinical decision-making, skills that distinguish excellent proceduralists from well-rounded interventional physicians. Finally, our on-campus simulation lab and daily one-on-one teaching create an environment designed for growth, technical mastery, and professional confidence. We think you'll find our program to be a warm, collegial, and supportive environment with a fun group of residents and faculty who share a wide variety of interests outside of work. We truly look forward to sharing that community with you. Thank you for interviewing with us. We can't wait to meet you during your virtual interview and share more about what makes our program such a great place to train.
I'd like to introduce you to our Interventional Radiology Clinic. It's actually right here on campus, in-site, built into the Interventional Radiology Division. We have 3 dedicated exam rooms. Every attending has 1 day of clinic a week, and the focus is to make sure they have the proper environment for evaluating patients and making good decisions, as well as post-procedural care. During your PGY 5 and 6 year, you're fully integrated into the clinic during those rotations to make sure you have mastery of those clinical skills.
Hi everyone, I'm Erica Emmons. I'm one of the faculty here at Wake. I'm excited to tell you a little bit about what you can expect from your training here. We're a high volume practice and we're a level 1 trauma center, as well as we have a dedicated pediatric hospital and we're a cancer center. So you can see a full range of things here, and to facilitate that, we have a lot of rooms and a lot of equipment to help us. As you can see behind me, we have one of our angio suites. We have a total of 3 angio suites. We've got a CT scanner that we do procedures in, 2 biplane rooms, and then 2 rooms that have C-arms in them that we do more minor procedures in. So there's a lot to help facilitate what we do here. You can see everything from the bread and butter, lines, tubes, strings, things like that, to uterine artery embolizations, venous and arterial work. We have kyphoplasties that we do. The vascular malformations component of what you'll hear a little bit more about is something that we take pride in, and we have the full gamut of cancer treatment. For me, that's something that I'm particularly interested in. So you'll see everything from our liver-directed therapies with Y90 and chemoembolization to our microwave ablations, our renal cryoablations, our lung ablations, as well as pulsed electric field ablation. So there's really kind of something in every realm that we touch that you'll be trained in. And by the time you're done with your training here, you'll feel comfortable in kind of all of those realms and be able to carve a path for yourself. So we're looking forward to having you join us.
Hey everyone, my name is Achinthi Patel. I'm one of the integrated IR residents here at Wake Forest. One of the things I really enjoy about training here at Wake is our approach to autonomy. So you get your first experience in IR here at PGY1, so you really get 6 years of experience in IR. And when we first start out, you're doing simple procedures, parastoras, drain exchanges, vascular access, things of that nature. And you'll have an upper level senior resident with you or an attending kind of showing you the ropes. And as you demonstrate competency, as soon as possible, we try and get you to be primary operator and eventually to the point that you can perform these procedures independently. And then as you move forward through the ranks, you get to do more and more complex cases to the point when as an upper level resident, you're doing more advanced cases such as traumas, liver-directed therapy, things of that nature, all solo scrubbed with the attending either in the control room or just kind of next to you with a headset, talking through everything. The other thing that I want to harp on is our kind of case exposure. So we talked a little bit about the case diversity in this presentation, but something that I really personally enjoy is our vascular malformation experience. So Dr. Miller runs one of the largest vascular malformation clinics on kind of the East Coast, and we get a lot of experience treating AVMs, venous malformations, back alpha malformations, and everything in between. What that allows us to do is open up our ability to research those topics, and so we have a lot of experience doing working with advanced imaging modalities and guiding our treatments, and have an ability to publish that and present that at national and international conferences. And so that's something that I personally really enjoy. And so that, the autonomy, the approach to education, and our research experience is something that really draws me to Wake.